Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, a cardiologist from Houston, Texas. The featured presentation today is a study that was reported in the New England Journal of Medicine on August 26, 2022, which goes by the name Secure Study, which looks at the effect of a miraculous poly pill. That is a combination of pills that reduce cardiovascular mortality by a substantial degree. So let us begin with the feature presentation. Before I do that, I kindly request you to please do subscribe to our YouTube channel and watch a number of videos we have on cardiovascular education for the public. Miraculous poly pill reduces cardiovascular risk by 33%. That's a substantial decrease in the cardiovascular risk among those patients who already were diagnosed to have heart disease in the form of a heart attack. So let us see what we can learn from this study. As I said, it was reported in Europe and also in New England Journal of Medicine just this week. The Miraculous Poly Pill study included three components in a single pill, and it was developed by a Spanish company. The trade name was Trinomia. Tri means three, nomia means name, I guess, three names. Ramapil, which is an ACE inhibitor in the dosages between 2.5 or 5 or 10 milligrams per day. Atorvastatin, which is a cholesterol lowering drug, which is given in the range of 20 to 40 milligrams per day, along with aspirin, 100 milligrams daily. You can follow my arrow here. Aspirin, 100 milligrams daily. So these are the three medications that were included in the poly pill. One of the interesting things they noticed was that those patients who were on this poly pill were more compliant. That means more people on this in this group were taking the pills compared to the control study who were getting three separate pills, basically the similar kind of medications, aspirin, Ramapil, or atorvastatin. This is nothing new because as cardiologists, we prescribe these medications routinely to almost all patients with cardiovascular disease. An aspirin to prevent any blood clot formation, Ramapil to improve the heart function and also improve the outcomes, and of course atorvastatin to lower the cholesterol levels. They looked at 2,499, that is one shot of 2,500 patients with a history of a myocardial infarction. That is, those patients who had a heart attack to begin with, they were included in the study. The age groups varied between 65 to 75 years, and they had at least one risk factor, such as diabetes or kidney dysfunction. 31% of the study population was consisted of women. The study population also had multiple risk factors. About 77.9% had high blood pressure, 57.4% had diabetes, and 51.3% of patients had history of smoking. The study was followed for 3 years, and they looked at four major cardiovascular endpoints. Number one, deaths from cardiovascular diseases like heart failure, irregular heart rhythms, or patients having non-fatal myocardial infarctions. That means they had a second heart attack, but it was not fatal. The third one is non-fatal stroke, or patients who had heart attack in the study group, they later on went to develop a stroke. Or those patients who had emergency revascularization in terms of having like a stent placement or a coronary artery bypass surgery. When they looked at these four endpoints, they noticed 71 patients in the standard treatment group, those who were receiving three separate pills of similar kind or nature, whereas 48 patients in the poly pill, those who were taking just one pill a day that contained all these three medications, had these cardiovascular events which I talked to you in the previous slide, namely any one of these. The composite endpoint was that those patients who had a history of myocardial infarction, who received this poly pill, which is they take one pill a day which contains 3 different medications, there was a 33% reduction in the cardiovascular risks over a period of 3 years. And one of the major differences they found between this group and the standard treatment group was compliance. That means more patients were on the medications at the end of the study compared to the patients who were on a standard treatment. So, ladies and gentlemen, in conclusion, this is a very interesting study which emphasizes the importance of medication compliance. As doctors, we can make a diagnosis, we can give you the medications, but it is up to you as a patient to make sure you take all these medications as they are prescribed. These medications are not only given to just control your cholesterol, control your blood pressure, or control your pain, but they, in the long term, they are supposed to reduce these cardiovascular events. By taking these medications and increasing the compliance, we can dramatically reduce the subsequent cardiovascular events. I hope this has been educational to you. We have more than 250 presentations for public interest in terms of heart and vascular diseases. Please do watch them, and please do subscribe to our YouTube channel, and I will see you in the next presentation. Thank you so much for watching this presentation.